Well, many thanks, Joseph Watson, there with the background report. And we have our guests who are already seated here in order to discuss this very important topic this morning. And here in the studio, we have Dr. Professor Shuaib, Executive Director and Chief Executive Officer, National Primary Healthcare Development Agency. It's a pleasure to have you, Dr. Shuaib.
Good morning, viewers. Thank you for inviting me.
Thank you so much. And we also have right here in the studio Dr. Eduardo Soledis, UNICEF Nigeria Chief of Health. Welcome to Good Morning. I hope I mentioned that I'm pronouncing it properly.
Yeah, indeed. Thank you very much. Good morning, Nigeria.
Thank you so much.
And also seated in the studio is Dr. Isaya Vatsa. He's Acting Executive Secretary, FCT Primary Healthcare Board. You're welcome to Good Morning, Nigeria.
Thank you. Good morning, Nigerians.
We also have joining us well, but not available for now from Kano, Dr. Walter Kazadi Mulombo. He's the WHO country representative here in Nigeria.
Okay, now while we are with a connection with Kano to get on board, Walter Kazadi Mulombo. Let's move on and then see what we will be able to make with the remaining times we have on the remaining time we have that is on this program. Rota, I will start with you, Dr. Faisal. Rota is not like malaria, diarrhea, measles and some other commonly known diseases which you're used to, brought up with. We saw them, we are managing them. When we say rota, somebody start asking, what is rota?
Right, so rota is actually from a Latin word that describes the nature of the virus. The virus is round in shape, so Latin word for round is rota. So that's where they got the name rotavirus. But in actual fact, rotavirus disease is very, very common. When you see a child with diarrhea, that is to say watery stools, chances are that in close to 50% of cases, half of the cases, it is due to rotavirus disease, right? So in a large number of cases that you see children having diarrhea, it is due to rotavirus. It's just that maybe we'll not call it rotavirus disease. We'll just call it watery stools, or we'll call it diarrhea. But it is a very common, highly infectious disease that occurs quite widely in Nigeria, just like the introductory documentary talked about. It is quite common in Nigeria and responsible for up to 50,000 deaths in children under 5 on an annual basis in Nigeria. So it is a big deal.
If it's a big deal, I mean, why will it be a big deal ever since, but now? Why the hype? Why the noise? UNICEF is coming into it, World Health Organization is coming into it, and a lot of other strong organizations are really moving in, and then insisting that nations and countries must, put it in their own routine immunization programs and the rest of it. Why now and why this?
Yeah, because it is because the rotavirus vaccine is so effective, right? So here we are for several decades, right? We are aware of the way this vaccine can work. However, before it is introduced into Nigeria, we have to fulfill some of the requirements. For example, even our routine immunization coverage has to reach a particular level, because you don't want to introduce a vaccine and then it is not well utilized. So in the course of the last few years, we've been able to attain those routine immunization coverages, and then we've been able to fulfill some critical criteria. And of course, the burden of disease is very, very obvious. So all of these constellation of requirements have now fallen in place thanks to the leadership of President Muhammadu Buhari, the Honorable Minister of Health. We've been able to advocate to our global partners and our donors, and they've been able to see that there's a justification to bring this vaccination into our program. So it is a huge investment on the part of the federal government and our donors, but it is a worthwhile investment.
Indeed, talking about international partners and international donors, let's bring in Dr. Eduardo. Dr. Eduardo, we saw you in the report before the program started, and can you tell us how many types of vaccines is acceptable here in Nigeria? Is it the same the world over? And how is it been accessed by governments?
Okay, thank you very much for this question. I think here in Nigeria, the government and Federal Ministry of Health and NTA have been doing a great job to really introduce new vaccines and to have a very solid schedule, calendar for vaccination for children. At this moment with Rota, it will be like 18 antigens, so different vaccines that we have available for children, but as well for adults, like for example, tetanus or COVID-19. It has been a challenge to really expand the capacity of the country to store these vaccines, because as you know, many of these vaccines, they need cold, they need like particular needs for storage. So the country has expanded that massively. Now they have the capacity to get these vaccines. And regarding the timing and for the calendar for children, I think we have a very sound, safe timing for the vaccines. Rotavirus is going to be administered at 6 weeks, 10 weeks, and 14 weeks, but as well to any children under 1 year old that didn't receive it previously. Before yesterday, before Monday, the vaccine was only available at private sector and some private facilities. As I was commenting, it's a really quite expensive vaccine in other countries. But here, starting on Monday, it will be fully for free in the Northwest, North Central, and Northeast, and next month as well in the Southern states. So I think this is really a good landmark for the country.
Doctor,
Yeah.
the acting executive secretary of FCT Primary Healthcare Board, and you're right at the center here. And of course, any other meaningful good example that could be given about this will be from your own domain. Tell us, this vaccine and this vaccination in the FCT, for instance, how is it going to be? What are the plans on the ground, for instance, in order to reach out to as many children as you can? I know children, whenever there are things like this, and if they are really new and novel, especially when they have the name Rota, not measles, or whatever, again, some eyebrows will be raised. What are the plans by the FCT in order to address this issue and get this vaccine, far and wide?
Thank you very much. The good news is that it was flagged up in FCT on Monday. And the good news also is that as at yesterday, the vaccines are already at the facility level. Have been distributed to primary healthcare facilities, and it's free of charge. And the good news is also that people have already been sensitized to take up this vaccine. The good news also, I always want to tell you the good news.
It's all about good news this time around.
The good news about the vaccine is also the fact that it is free of charge, cost nobody any trouble in FCT in terms of giving it to the children. And then the fact that this vaccine is available, to be available at the doorstep of the patient. And to also beyond putting it at the facility level, we will also have outreach services that will be providing, taking this vaccine to the doorstep of the families. The other important thing is that different stakeholders have been sensitized to take on this vaccine. This is going to be a different ballgame in terms of acceptability. And then, of course, any parent that experienced diarrhea in his children is eager to take up this vaccine. This is the vaccine that will solve the problem. And also the bad news. You don't allow your child to have diarrhea before you talk about the vaccine. It is only when you are taking the vaccine that you can be protected. And then also the bad news about it is that it cannot be treated with antibiotics.
Okay.
So the best bet is the vaccination, other hygienic practices, hand washing, care of the moral, environmental sanitation, and host of other things, and also taking other vaccines. I always want to use my
other vaccines like
other vaccines that routine immunization.
okay.
Routine immunization so that you can protect yourself from other diseases, common diseases in your environment. The other thing I also want to tell people about, I always use myself as an example. Anytime I hear about vaccine, particularly for adults, even for children, I use my own children as a first test. Even this COVID, when I take the vaccine, I don't even tell my family, I took the vaccine myself first, because I know that the best way to produce vaccine, it is to protect you from the disease. And even the way the vaccines are developed. And I think this is the information the public need to know about vaccines. They are produced from a product that will stimulate your system to produce an antibody against that disease. And once it produces that antibody against that disease, if you come in contact with the disease, you'll be protected. And for the community to be protected properly, we need a larger population to be vaccinated to achieve herd immunity, what we call herd immunity, 70-80%. And the good news is also FCT. Very soon, virtually all the children that will be taken to our facility will be vaccinated. This vaccine is available already in the facility. We are also going to expand to private sectors. private health facilities will also make them available. We have over 400 health facilities that provide routine immunization, and it will be available all over.
Free of charge.
Free of charge. I think people need to know that it is free of charge.
But Professor, we need to identify a disease before we start talking about vaccine, and this disease has already been established. Most people think when children are purging and having diarrhea, they think it's the teething process. And how long does this Rota manifest? How long does it take before it will manifest? And how is the impact on it on the child? And what do the parents need to do to bring it down to the barest minimum before they vaccinate the child?
So first up, it's always better to give the vaccine. Like they say, prevention is better than cure. So it's very, very critical that once the child is at 6 weeks, you go for the other vaccines that you're already aware of, and seize the opportunity to also take the rotavirus at 6 weeks, at 10 weeks and 14 weeks, right? So before the child reaches the age of 1 year, they should have visited the health facility 5 times for the different routine immunization vaccines. That needs to be very clear to every mother, every father, every guardian in Nigeria, that you have to go to the health facility 5 times to get the childhood immunizations. And now we've introduced the rotavirus vaccine. Why is it so important that we herald this progress in our ability to protect our children? Because rotavirus is a virus that exists all over our communities. It's there in spaces, it's there on surfaces.
Where do you get it from, actually?
So it's a naturally occurring organism, right? Just like any bacteria, right? So it's a virus that is available. So the most common way to contract it is through food and water, right? And also when you touch a surface, right? This is why it is most common in children that are aged from 3 months to about 35 months, around the time that they are beginning to play around and touch surfaces that might be contaminated. And once they touch a surface that has the virus, then they can put their hands in their mouths, and exactly at the first point, then they get infected, and then after about 2 days, they start having fever, they start vomiting, and then thereafter they start experiencing diarrhea. So diarrhea is watery stools. Now, once they start experiencing those types of symptoms, the usual thing, like you mentioned, is people wondering is just teething. But in a number of cases, it could be due to other diseases, right? It could be that the child has malaria or pneumonia, and diarrhea might be one of the manifestations. But for rotavirus infection, you begin to see that the child starts getting dehydrated, right? The child gets weak. Sometimes the child will be crying, and there will be no tears because they don't even have adequate water. Exactly.
When I was doing the research,
no tears. That's it. And then you begin to see that their lips are very dry, and that is why it's very important what Dr. Vasta has mentioned, that you continue to do exclusive breastfeeding even when the child is having diarrhea. You make sure that you continue to observe hand hygiene. You continue to make sure that you give ORS, or oral rehydration solution, along with zinc. It's very, very important that to protect our children from this disease, that we observe good personal hygiene, environmental sanitation, because this is a disease that occurs in environments that are not clean. This is why even young adults also contract rotavirus. The only thing is that it may not be as severe.
Exactly.
Well, it could be. Exactly. Absolutely. Those are some of the causes of diarrhea and vomiting even in adults. But when you're an adult, of course, it's too late for you to take the vaccine. That is why it's important for you to take it at the points that we've listed.
You said there's no cure. So we can have get sick and we cannot take the vaccine. What happens to that?
Well, the good thing about it is that it is because it's a virus, it is eventually self-limiting in an adult, right? So you get sick, right? But over time, if you take the right types of, supplementary measures, such as taking oral rehydration solutions, you rest, then over time your body's immune system will overcome it. But for the child, it can be, the beginning of the end for that child if the child is not well managed.
Dr. Faisal, let's just dwell on that a little bit. Some further clarification will go a long way in explaining diarrhea generally. Diarrhea, looking at it from the point of view of just knowing it to be diarrhea as we used to know among children, among adults, and whatever. The normal reason being given is some hygienic reasons, bad hygiene, and then it's often related to bacteria generally, because you can have it as maybe part of symptoms of cholera and some other things. But here we are today talking about a diarrhea. Caused a diarrhea-related, diarrhea-like disease caused by a virus, and that, as she said, it may not have any cure as such, but the virus is around to just stop it from spreading. Explain further for us and give us further clarification to differentiate this very rotavirus and its own symptoms as it is from the normal diarrhea we used to have, especially the ones that affect the adults and the one that affect the children, which is not rota.
Right. So the distinction between rotavirus disease and any other type of diarrhea, for example, in an adult, right? A typical adult, if you're having diarrhea, it's probably related to immune. This is why it is important that she called it food poisoning, because the onset of the diarrhea and the vomiting is linked to ingestion of food that even you realize that maybe that is the source of the problem. And then of course there are indications that maybe other people that ate the food are also suffering from the same symptoms, right? That's typically what happens when you have food poisoning, right? But for the diarrheal disease that we see in children, typically a child will react to any illness with diarrhea. That is why they call it diarrheal disease.
Okay.
Yeah, that's it's a normal feature with children, that when they are sick, when the child starts having diarrhea, you know that something is going on. But out of this multitude of diarrheal diseases, we've been able to do investigations, right? So when you take the diarrheal stools, when you take fluids from the guts of the child, we've been able to grow this virus. That is why we got to realize that a large proportion of diarrhea may be due to illnesses, right? But there's a significant proportion, close to half of these diarrheas, are actually caused by this very naughty round-shaped virus that we call the rotavirus. Now, if the diarrhea is non-specific, for example, it is due to malaria, pneumonia, or any other disease, once you treat the malaria or the pneumonia, then the diarrhea stops. So you have now treated the root cause of the problem. But we've now been able to recognize that, hey, with those diarrheal diseases that are due to rotavirus infection, we now need to find a way of protecting the children from contracting the virus, because we do know that there is no known cure for viral diseases, right? So your best approach is to prevent it. And this is why we've been able to engineer a vaccine that protects against the virus. How does it do that? That is what Dr. Vata has sort of alluded to. So when you give the vaccine to the child, it uses the natural immune system, the natural systems of the child, right, to develop specific proteins that we call antibodies, right? Once it develops those antibodies, the antibodies are able to now remember the next time the actual virus infects the child. So what you are giving to the child as the vaccine is something that looks like the naturally occurring virus. Okay. Right? So that now, but it is not in a dose, it is not in the form that will cause the disease. Usually it is either the killed form of the actual disease, cause of the virus, or a form that is already weakened. And what it does when it is injected or dropped into the body of the child, it doesn't cause disease. Instead, the body will now find a way to overcome it. So by overcoming it with the antibodies, the body now knows what to do the next time the real culprit comes. It is all ready, and then it destroys the virus before it can cause disease. So what vaccines, rotavirus vaccine, measles vaccine, hepatitis vaccine, they work in all similar ways. They just use our natural body system, trains our body's natural system to fight the actual disease when it does occur. And this is very, very critical, because when people talk about, the white men want to kill us, that is why they are giving us vaccines, it is ridiculous, because even before these vaccines were brought in this form, Africans already took herbs to protect against some diseases that they are already aware of, right? The only thing that is different now is that the formulation is different in a way that makes it easier for us to do it on a larger scale. So vaccines, since the advent of history, are the most important public health intervention that we know.
Okay, let's hear from...
Our Zoom is ready?
Yeah. Okay, the Zoom is ready. That's Dr. Walter Kazadi Mulumbo. Kazadi is joining us from, Kano. He is the World Health Organization country representative in Nigeria. You're welcome to Good Morning Nigeria.
Good morning, and thank you.
Good. Let's go along and then move on with you, and then hear your own perspective or your own views about this very topic we're discussing this morning. As you should have known, it's a rotavirus, and then it's a vaccine, and it's used in Nigeria, having been launched, and then how people are going to receive it. You reside in Kano. You are in Kano right now, I must say. And then being in Kano, a very cosmopolitan city, and where we think there are lots of people that may be affected by this, lots of children that may be affected by rota disease. How is the story in Kano? And then so far, given its cosmopolitan nature, how are people receiving this message of vaccination against rota disease?
Thank you very much for having me on this emission. And sorry, I joined late. I've been having issues to join the meeting since early morning. I came to Kano with the purpose of meeting the Emir of Kano and the Executive Governor. Partly it's to support the Scales 3.0 implementation, where Kano is among the states that have done well. So I'm expecting that Kano will do well also in terms of introduction of rotavirus vaccine, which is very, very important. I see the city's cosmopolitan is pretty much populated, and looking around, you might expect that something that the real diseases in infants and children should be something common, and that's one of the messages I'm going to emphasize with His Royal Majesty this morning and the Executive Governor. Kano has a history in terms of addressing vaccine hesitancy from the time of polio, when they got on board with help of the Sultan of Sokoto and Emir of Kano. Things change. So I'm going to carry this message to encourage the Emir of Kano and the governor and the authorities to really encourage the population here to bring children to get rotavirus vaccine, because rotavirus is a major cause of diarrhea disease in children, and if we can scale up this vaccination soon, we'll avert a lot of unnecessary infant and children deaths in a place like Kano, where I am. So I look very much forward to this visit, which will start in the next 1 hour and a half or so, to bring this message over.
Okay,
Okay, just a little, let me just make a little follow-up there. Given the antecedents and the history of Kano as regards, vaccine and its acceptance and reception in Kano, how equipped are you to see to it that your visit becomes really fruitful? What are you going to really put on the table that will look as a step different from steps being taken in the past, in which case would yield something more positive than maybe some resistance, that forbid?
Sorry, I didn't get your question very well. Would you like to repeat, please?
Now, what I'm saying is, what are you going to do differently now in order to address the issue of hesitation and resistance in Kano, given its own history as a place where people hardly would accept such vaccines just easily, I must say?
They've just done it with COVID-19 vaccination. Kano was among the states that were lagging behind, and they are among the 4 states that are showing the way. We indeed are looking forward to learning more on what Kano did differently, and I'm sure it will also apply to rotavirus vaccination. And this is why my visit to the mayor of Kano today this morning is very, very important. I'm going to encourage him and the council to really get on board, use what they've done for polio, use what they've just shown for COVID-19 vaccination. And I'm sure it's new, it's unfolding, but it's worth pushing, because it will make a huge difference in this city of over 20 million population. And also give an example to the rest of Nigeria that it can be done. If it can be done in Kano, it can be done everywhere. So, and we are really confident that with our discussion, the Emir of Kano and other traditional leaders, and I'm aware of the role they play for polio, for COVID-19 vaccination, I'm sure they will help a lot in this new campaign. And plus, the vaccine is free, so why not go for it? Because it will save Nigerian children.
Yes, but I know you picked Kano because of the population there and the issues we must have had with the polio vaccine. Then you have a real interest in Nigeria and how our health system works. This vaccine has been introduced into the Nigerian health system, but they say it is in short supply. So how can Nigeria procure this, and what are the necessary plans that has been put in place for procurement of this vaccine to be able to handle the kind of population we have in a place like Kano?
Yeah, thank you. The issue of the vaccine short supply is a global one, but I don't believe the rotavirus vaccine has an issue to supply a country like Nigeria. The vaccine is available, but alongside this introduction, we've been supporting the Nigerian government to build capacity for local manufacture of vaccine. So, and you know that WHO is selected Nigeria among the 6 countries for introduction of mRNA technology. This is just an entry point to Nigerian manufacturing other vaccine as well. And I'm aware that some partners are coming as soon as tomorrow, if I'm correct, and they are coming to continue to further that discussion, and we will be happy to support the national authority, the NTA, CDA, Ministry of Health, and other stakeholders to get really the capacity to produce vaccine locally, because Nigeria as a market, as a population, Nigeria is several countries in one. If we can do it, we can get it right with Nigeria, I think Africa as a whole will be better off. And it's an investment worth pursuing, and in the long run, it will pay off. So WHO, UNICEF, other partners, we are really on board and eager to push Nigeria to get that capacity to produce vaccine and other medical product locally. I believe Nigeria has the capacity to do that.
Dr. Mulumbo, thank you so much. Let me come back to the studio here. Dr. Eduardo, let's have your take on that question I threw to him.
Yes, thank you. I would like to complement that at this moment we have 3.8 million of doses of vaccines for Rota at country, that we are receiving next month another 1.4 million doses. And by the end of the year, we'll have 19 million doses of vaccines, of rotavirus vaccines, stored in the country. At this moment, for some key vaccines, there are not issues at global level. For example, this year, we don't have any issue with having COVID-19 vaccines available at country level. However, Dr. Mulumbo and WHO is right, we want as well to change the narrative. So to create capacities and to support the government to develop capacities at country level to develop vaccines. Nigeria, as you know, was producing vaccines until 15 years ago and seems like 100 years ago. So the capacity to do it is there. But I would like to go further. It's not only about having the supply of vaccines ready. It's about how is our capacity to deliver these vaccines to the children and to the adults that they need that. And for that, what we need is a strong primary healthcare system. So it's not enough having the vaccines in our warehouses. What we need is to have human resources, doctors, nurses, chiefs, VCMs, voluntary community mobilizers, engagement of traditional leaders. What we need as well is a strong supply chain. What we need as well is good data to know where we have what we call the zero-dose children, the children that they don't have any single vaccine. We need to know where these children are so we can reach them and we can actually improve the vaccination coverage. And as well, we need good governance and leadership in the health sector. So what we need, that's why, for example, last week, jointly with Dr. Faisal, with the Minister of Health, WHO and partners, we launched the Primary Healthcare Leadership Challenge to incentivize the governors and the states to really invest in primary healthcare. Because if you don't invest in human resources, in capacities, even if you have the vaccines in country, you're not going to be able to deliver those to the children that they need it.
Okay, thank you, Dr. Eduardo. Dr. Isi Hayobacha, let's hear more from you about what Eduardo said. We're talking about spread now. We're talking about reaching out. We're talking about having more children vaccinated against water disease. And the vaccine is free, as you earlier said, and it is available as being put forward by the figures we have, and it's going to remain available and free as much as the exercise, as far as the exercise goes. What is the reach, if I may ask, what's the reach and how aggressive for you in moving into the hinterland? The others see the urban, settlements may not be so much of a problem. But reaching out, as he said, a strong primary healthcare system is very important. What's the reach? What's the spread?
Coincidentally, as of yesterday, I was in a facility, a very remote facility in Kwali Area Council, and the vaccine was already at that facility. But beyond that, we just don't want to just talk about being in the facility. We are reaching out to the families, to the community leaders, the stakeholders in the community to understand this is another gift from the government to the children, the future of tomorrow, to be protected from diarrhea disease that is deadly. One other thing people have to know that this is a deadly disease. Rotavirus, diarrhea related to rotavirus is deadly. And the only solution to it is to be protected by being vaccinated. And once a child is vaccinated with other measures, exclusive breastfeeding, proper hygiene, and a host of other measures that protect that child from other infections, the child will be protected and will grow well. Another thing that we also do is to also sensitize using traditional institutions, religious leaders, women leaders, caregivers to be actively involved in ensuring that the children are taken to the facility for vaccination. And then we are on ourselves in terms of leadership challenge. The FCT administration is really committed to this cause. In fact, that is why they co-funded the launching of this program in FCT, and the FCT being the first place where it was launched, we are taking off. We are taking off to reach out to the public, to the children with this vaccine. And I'm also very pleased to hear that the vaccine supply will be continuous. So the issue of challenge of shortfall is not even there. The issue is that people should bring their children and be vaccinated. And if you reach any facility, you don't have a describe where they are, please reach out to us. I can even give a number that you can reach out to us in FCT. Maybe I can just call the number and say I can reach out to you. You don't have any child to go to a facility in the list.
Call the number.
080
Yeah.
33
Yeah.
142 463.
Call it again.
080 33 142 463. You can reach out to us. If you are taking your child for vaccination and you are telling the vaccine not there, please reach out to us. We arrange and bring the vaccine to your community. Yes. We don't want any child to be missed in this exercise.
Every child
Every
must be
child should
vaccinated.
be reached with the vaccine.
There is this issue of immunization. Generally, we were brought up to find that health workers go from house to house, knocking at doors, asking for children for vaccination, and then tagging and numbering and putting the house in order and then marking it. That's for statistic purposes, and that's another way of reaching out. Dr. Faisal, when we come to this level, I didn't hear any one of you talking about, this house-to-house issue. We've all been referred to, primary health care systems, take your child, not that we meet you at home and do this. Is rotavirus different from this? Is the approach not in this relation? Is it because it's between 6 to 14 weeks or thereabout? How is it? Is there going to be any house-to-house thing, or how is it going to be? Talking about the primary healthcare system and the strength of it that's been alluded to by Eduardo here.
Yes, so there are two different ways of getting vaccines to kids. So the rotavirus vaccine is being added to what we call the list of childhood immunizations, the routine immunizations, the same type that your parents, my parents, took us to the health facility for. So it is normal that when a child is born, the parents should take the child to the health facility, right? Like I mentioned, 5 times before 1 year. And then by the time the child is about 15 months, then the child has another vaccine that they need to take. That is what we call routine immunization. The house-to-house campaigns are supplemental to the routine immunizations, right? So for instances where we're not able to reach kids, we now organize a campaign to reach them. Those campaigns are very expensive. They are not normative. They are not the normal approach. The normal approach for any responsible parent, any parent that understands the importance of vaccination, is that once you give birth to a child, it's part of the responsibility of parenthood that you take the child to the nearest health facility. And there's no place in Nigeria where you will walk more than 5 kilometers or travel more than 5 kilometers and you don't find a health facility, right? But with this introduction, we are putting them in the health facilities. But apart from taking the kids to the health facilities, even as part of this routine, there's what we call outreaches, right? So every health facility encourages people to come to the health facilities to take their vaccination. But that health facility also, usually about once a week, plans outreach sessions where they go to the communities with the vaccines, with their cold boxes, making sure that the vaccines are kept in the temperatures that will keep them potent. And they go to the health facilities and give go to the communities and give the vaccination. Sometimes the site of this outreaches are the palaces or the compounds of the traditional leaders. This is why traditional leaders are very, very key when it comes to primary healthcare. Only yesterday, we hosted the Southwest Traditional Leaders Committee on Primary Healthcare Delivery, led by His Imperial Majesty, the Oni of Ife, along with paramount rulers from 6 Southwest states. We had an opportunity to look at how we can deepen the conversations, the collaborations that we've experienced with the Northern Traditional Leaders Committee that were very, very key in the eradication of white polio viruses. So those lessons are what we're replicating in the Southwest under the leadership of the Oni of Ife, who showed very, very strong leadership. He demonstrated his passion. It was a very, very successful meeting because we're able to align around how government can utilize the platform of traditional leaders to reach the people, because we all know in Nigeria that the traditional leaders, the religious leaders, are the custodians of our cultures, the things that we hold very dearly. And when people hear from their traditional leaders, they know this is good. And we realize that we've not been doing enough of this, right? This is why we had the issues with Kano. Right now, Kano is a completely different place, right? It's absolutely, people understand that nobody is trying to poison you, nobody is trying to stop you from being vital. So when we came with the COVID-19 vaccination, right, Kano took off like an airplane, doing very, very well. And I hope that other states that are not doing as well, will learn lessons from states that are doing very well. Now, over 40 million Nigerians have taken the vaccines, and they're doing very well. I am sure you guys have also taken the vaccines, right?
Including the boosters.
Absolutely. 40 million Nigerians cannot be wrong when it comes to COVID-19, right? So we want to have these vaccinations completely rolled out. We're now moving not only from the health facilities, we're going settlement to settlement, door to door, using the Skills 3.0 to make sure that people have the opportunity. So we're not looking at just coverage, but also equity, that no matter where you live or work in Nigeria, you have the opportunity of access to COVID-19. But also the health workers are going with other vaccines, including the Rotavirus vaccine. In the next few weeks, they'll be going to houses, going to marketplaces, motor parks with the vaccines. So we're delivering an integrated approach when it comes to this vaccination. So it's not just the COVID-19, but it's also the opportunity to deliver a broader range of services, including vitamin A, supplementation, we're deworming kits, using this opportunity of COVID-19 to make sure that Nigerians have access to primary healthcare services.
Yes, it's all about willpower, and Dr. Eduardo has said government must invest in primary health care, because at the hinterland, at the subnationals, that is where the primary health care comes into focus, because that is where the bulk of the patients are. I was listening to you on the radio when I was coming to the office yesterday. You were complaining about lack of human resources, not being enough.
I was drawing attention.
Yeah, you were drawing attention to it. I was listening, and there's not being enough. So what are you doing on that? And apart from this, bringing them together to talk to them about all this immunization, getting it to the people that matters, are they walking the talk?
Yes. So if you recall, in March of this year, the Federal Ministry of Health convened through the National Primary Healthcare Development Agency the PHC Summit, wherein we brought our donors, development partners, private sector, traditional religious leaders to align behind a vision for primary healthcare in Nigeria, where you don't have to go more than a kilometer to find a primary healthcare center that can deliver good quality primary healthcare services. You go to such a health center, they have the right and full complement of health workers that treat you with dignity, with respect, right? You go in there, you're well greeted, and by the time they attend to you and you leave that health facility, you look back and say, wow, that is fantastic. I can't believe that I'm actually living in a primary healthcare center. I can't even believe that I am living, the foundational aspects of our health system. We want to have those types of primary healthcare system. So we are harmonizing and streamlining all the resources. Instead of disparate investment, government does this, the donors do this, the partners do this, the private sector. We have brought everybody together and say, what is it that we need as a minimum to make sure that we have in every political world one functional primary healthcare center. Right now, when you go to our primary healthcare centers, you see some level of service. So what we're saying is, we're not there yet. Instead of having maybe a situation where you have 10 cars and none of them is working, right? You have to push each and every one. How about starting with fixing one car, making sure it is functional, and then you gradually move to when you fix all 10 cars, but making sure that there is a clear alignment around what the vision is. We want to recognize the great work that our governors are doing, local government chairmen are also doing. But we also want to send out a clear message that it is not just about the infrastructure. There's a lot of focus on renovating and building primary healthcare centers. But you build them, if you don't recruit the competent health workers, then they are going to be there, right? They'll be invaded by goats and reptiles. So the first and the most important thing is to make sure that in your primary healthcare system, anywhere in your state, that you have the full complement of health workers that can deliver their services. As a matter of fact, if I were to talk about the extreme, you can deliver primary healthcare services in one room, but you need a health worker that knows what they are doing, a health worker that will deliver the quality service and do it in a way that is compassionate. Those are the things that we want to focus on. It's not about having 20,000 primary healthcare centers in your state. It's about the quality of those primary healthcare centers. And the first level is to make sure that you don't have 100,000 health workers in your employment. But out of these 100,000 health workers, how many of them have the right certification? They have the right qualification. They have the right attitude. They have the right motivation to get the job done. If they don't, then you need to streamline them. Those who are not supposed to be in the primary healthcare space, you can deploy them into other sectors where they can really be utilized. They can be retrained and work in other sectors. But health is so specific that you need people that have the right training, because you never know. You could retire to your village and then you'll be responsible, for the kind of service that you get in your primary healthcare center. If as a leader you do not do anything about that primary healthcare center, well, when you are in your 60s or 70s or 80s, you will go back and meet that primary healthcare center that you refuse to invest in. So the message is very clear. It's unequivocal. Human resources, human resources, human resources.
Okay, thank you so much, Dr. Faisal. Dr. Walter Kazadi, if you're still with us, let's hear more from you about the chain of operation as this exercise continues. You're in Kano already, and of course, I wish you all the best as you take up your assignment of meeting, the Emir of Kano and some other notables in Kano. But while that is ongoing, can we hear your views about this chain of operation, looking at, the starting point to the end product, where you have the cold chain, you have the personnel as being put forward by Dr. Faisal, and then where you have, the children being brought forward. If this happens, what incentives are there? What incentives are there, most likely, if we're lucky to have you on? What incentives are there in order to encourage, parents to bring out their children to get vaccinated against rota disease? And how strong is that?
Thank you. First of all, and sorry I was disconnected. First of all, I wanted to add my voice to what Dr. Faisal was mentioning about primary health care. And from WHO perspective, as you know, primary health care is really, rather than a system to deliver health services at the grassroots level, primary health care is really an approach in a whole government undertaking, in a whole of society undertaking. It has several components. So if we look at primary health care as an endeavor of the Ministry of Health, then that will be the beginning of our issues. We are talking about multi-sector policy and action. It's not just the Ministry of Health, it's the Ministry of Finance and other ministries. Different donors that are supporting PHC in Nigeria are also interacting with different ministries. Bringing those ministries at grassroots level, it's important so that they harmonize the policies and action. And the second component is community empowerment. That's where the traditional leaders really a role to play. I would like to congratulate Faisal and his team for organizing this traditional leader quarterly meeting. We hope to join the one from the Northwest Zone, another zone when they are organized. And the last component is to have integration of services and public health functions. Disease outbreaks start in the community, in communities, and end in communities. So we need to empower the communities and to
doesn't
there's the issue of shortage humanity, implementing task shifting, and we can also use community mobilizers to deliver some of lower level function and free the time for healthcare workers. And we also need to bring the community to disease surveillance and response. The number of deaths, to come to your question, the number of deaths that we will avert by rolling out the rotavirus vaccination, it's in itself an incentive if it's well articulated. The recognition is an incentive, so we can tap into different type of incentives, not necessarily monetary. Recognition, access to training, capacity building are all form of incentive that we could tap on. And I'm really looking forward to discussing with the MA of Kano to see what the community might be expecting for them to contribute to this public health undertaking, which is worth pursuing. So, listening to the community is also an important element as we plan to roll out the public health intervention. So, I look very much forward to the outcome of this interaction. I'm sure it will feedback into the discussion we're having now. Over.
Thank you so much, Dr. Marambo. Will you still be there because we have another topic to discuss with you? Let me come back to the studio. Dr. Eduardo, everything has a time frame. Briefly, in 30 seconds, what's the time frame for this program you're having now?
So for rotavirus, now we are doing, so it's already rolled out in the Northwest, North Central and Northeast. In the next month, it's going to be rolled out as well to the Southeast and Southwest. So we'll have, by this year, we'll have all Nigeria covered with rotavirus vaccine. But as well, this is a long-term vision, right? So where we are going. In one side, we are strengthening the primary healthcare system. This is a much more longer-term vision because we need to train health workers, etc. But as well, we are planning, jointly with Dr. Faisal's team, to introduce new vaccines into the country. So we really hope that next year we'll have HPV in the country. We hope that you will invite us here to talk about that. And as well, even more important, we hope that hopefully next year as well, to have some malaria vaccine available in the country.
Dr. Watson, 30 seconds. Talk to your people.
I can always speak to the caregivers, the mothers, and other stakeholders who are taking care of the children. Take your children to the nearest facility for rotavirus vaccination. If you are not able to bring the child, please monitor the outreach services in your community when they bring the vaccine. And beyond this, please take other vaccines. It's extremely important. COVID vaccine is real. COVID-19 is real. The vaccination is effective. Most of the people that die from COVID are not vaccinated. Don't be the next person. Go and take your vaccine. If you are even late, and it's available free of charge.
Okay.
Rotavirus is free of charge. Neighbors, caregivers, please take your child today. Don't be late.
Thank you very much. Thank you so much, Dr. Issei Hayavotsa, the Acting Executive Secretary, FCT Primary Healthcare Board. We wish you all the best.
Thank you.
And a big thank you also to Dr. Eduardo Celedes, UNICEF Nigeria Chief of Health. We thank you so much for being part of this very segment of the program. And we shall invite you next again as you requested whenever the time is up.
Thank you.
Well, we will now take a break. When we come back from the break, we will be discussing 3 years anniversary of wild polio virus eradication in Nigeria. Stay back.